Before after hair transplant results in thin donor site hairs. Is it possible to do a hair transplant in a patient who has very thin donor site? In this video, we are going to showcase an incredible transformation of one of our grade 6 Norwood male pattern baldness patient who had very thin hairs in his donor site. Also in this video, we will discuss about our Saraswat Hospital app, which gives you a peek into the kind of results you can expect after your hair transplant. So please keep on watching this video in its entirety till the end. I am Dr. Satya Saraswat, a gold medalist plastic and cosmetic surgeon in this field of hair transplant since 2006 and a member of International Society of Hair Restoration Surgery as well as a diplomat of American Board of Hair Restoration Surgery, which is the highest certification in the field of hair transplant. We are going to discuss a 31-year-old male patient who had a continuous hair loss history of 14 years. So when he came for the first time to us for the consultation about his hair loss problem, and he had come with an orientation that he wanted to have a hair transplant. So as a custom, we did his trichoscopy, his evaluation of the donor site. We could on the touch itself feel that his donor hairs were very thin. When we did the trichoscopy, we found out that his terminal hairs, good quality hairs or the thicker hairs which are more than 0.06 millimeter, only 60% roughly his hairs were terminal, which is not very good. In a good donor site, 80 to 90% of your hair should be terminal. His average graft density was also very less. It was 73 follicular units per centimeter square. His average thickness in around 30 hairs was 0.061 millimeter. His coverage value was 8.46, which is very low, and his total donor site was around 145 centimeter. That donor site had around 10,500 follicular units, which were very thin. Average number of hairs per follicular unit was very low, again 1.9 in this case. We told him that, look, your donor site is not very good. We are not very sure what we can achieve out of it. Fortunately, he had some thin hairs in his recipient site, bald site also, which were very thin. They were vellus or baby hairs, but still this gives some support to the transplanted hairs as well. He understood all the things which we had discussed in this case, and he agreed for a medical treatment. We gave him this clear-cut opinion about the kind of results he can expect. So if you like such kind of informative videos, if this is what you're looking out for, we request you to please like this video. Next, we measured his recipient area from the front till the transition zone approximately, and we found out it was around 121 centimeter square. Since his donor density is on the lower side, we planned a density at the recipient side also on the lower side. Otherwise, if we try to extract more graft from the donor side, that will become very thinned out. So we planned a density of 30 follicular units per centimeter square. Approximately 3,600 grafts were used in his hair transplant. Exact number to be 3,650, and 1, 2, 3, 4 hair follicular unit distribution is also shown to you on the screen. If you are planning a hair transplant for yourself, you can call us at the numbers given here, or you can WhatsApp your pictures of your bald area and the donor area on these numbers itself, and we will try to reach out to you. Then coming to the procedure, it's a standard procedure which we follow. We do the hairline marking, trimming, give antibiotics, give local anesthesia, slit making or site creation, graft extraction for the required number of grafts, and the graft insertion by our technical staff under our supervision. So the entire procedure was done like this in his case also, and he repeatedly kept on coming for us in a follow-up, kept on taking the PRPs and kept on taking the medical treatment which we had prescribed in his case. And here you can see his before and after transformation successively over a few months, and when he came at a long-term follow-up, you can see his transformation over a period of months from the condition he was before the surgery with thin hairs, and at 10 months when he came for the last time in his follow-up, and it's an incredible transformation. He's very happy. We request you to subscribe to our Saraswat Hospital Hair Transplant channel so that you can keep on watching many such informative videos which we have made till now, and we'll keep on making them later on as well. Now over the app which we have discussed about, it's a Saraswat Hospital app. You have to fill some information from your side, and our AI based app generates a kind of result you can expect after your hair transplant. It's absolutely free of cost and available on both iOS as well as Google Play Store, and it's totally free of cost for you. So, and the link for this is given in the description below. It also tells you the number of grafts you can expect in your case and the questions which you should be asking your hair transplant doctor. In the end, to summarize, there are a few points I want to touch again, which you should always keep in mind before actually planning your hair transplant. Number one point is how the clinic or the doctor is planning your surgery. Are they giving you 100% guarantee? Because if somebody gives you 100% guarantee, I think it's unethical because a medical procedure and can fail. Also, what is the transparency being maintained in the number of grafts in the clinic? Number 3 is the involvement of the doctor in critical steps of the hair transplant. And even later on, he or she should be there to guide you about the medical treatments and therapies which you have to keep on taking. And if there are any problems, they should be there to resolve that as well. Number 4 is a clinic which has a permanent team. Permanent team is extremely important. If a clinic is hiring some technicians for a day job, it's not going to work out well for you in the long term. Number 5 is the qualifications and the credentials of the doctor. If you or your family member, your friends or colleague or anybody is planning a hair transplant, please share this video with them so that they know what kind of planning goes on from the part of the doctor or the clinic before actually doing a hair transplant in an individual case. If you want to see one of our other hair transplant patients' results, you can click the video on the left. And if you want to know the difference between FUE and FUT hair transplant, please click the video on the right.